today. Thank you so much for joining us for the Gulf Travel Show. As usual, it promises to be a very exciting and very entertaining show where you get to connect with your friends from the Middle East and tell them more about the Middle East market, and our friends from the Middle East get to know about the rest of the world. Our focus this time is going to be on Malaysia, and today I'm joined by two senior officials to talk about the world's healthcare marvel that Malaysia is. Malaysia, in terms of healthcare, has so much to offer, and today we'll dive deep into it and get to know more about everything that Malaysian healthcare has to offer. I'm joined by Miss Norhaslina Othman, the Vice President Facilitation for the Malaysian Healthcare Travel Council. Thank you so much for being with us.
My pleasure.
And next I have with me Mr. Mohammed Shahril Zainal, the Head of Marketing for Malaysia Healthcare Travel Council. Thank you, Shahril. Thank you for being with us today.
Thank you for having us as well.
Our audience in the GCC region is very interested about Malaysia and wants to know all about their healthcare facilities available. So I'm going to start with you, Ms. Norhaslina. First, I want you to tell me a little more about the Malaysian Healthcare Travel Council and what are the main areas that you focus on.
Okay. Hi, thanks, Devika. So Malaysia Healthcare Travel Council, or we are better known as MHTC, is actually an agency under Ministry of Health that is mandated for us to promote and facilitate the healthcare travel industry in Malaysia. So this is actually one of the successful example of public-private partnership between the government as well as the private players in Malaysia in promoting and facilitating the healthcare travel industry. What we do is that we are, in a way, a driver and a catalyst. So we are working with our private players, we are working with the government, influencing the policy to promote and position Malaysia as the healthcare travel destination in the region and also to the world. So as an agency, MHTC coordinates all the activities relating to healthcare travel and do all engagement with many stakeholders locally as well as abroad with the sole goal to ensure or to promote the healthcare travel industry and bring it to the next level. So I think in a gist or in a nutshell, that is what MHTC role is all about. So it is a heavy or huge responsibility, the trust given by the government, but we are seeing a very good cooperation and collaboration between the government as well as the private players.
Lovely. That's very interesting, I must say. So, Shahril, let's get you in here and let's hear from you. What are the initiatives you plan to take to restore confidence in travel and tourism, and especially in the nation, and especially also for the GCC markets?
Okay, thank you, Devika. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, actually, talking about what initiatives or what an effort that we have currently doing and all that to restore, confidence, to restore trust and all that. I think because most of the sector has been impacted very badly, of course, tourism as a whole, and of course, at the end, for medical tourism is also affected very badly. So that's where Malaysia Healthcare Travel Council, together with the commercial players, coming together to basically focus on capacity building. So that's basically to get all the travel agents, to recruit them, to educate them on what are the potential of medical tourism and get them ready, when the borders are reopening, soon. And of course, with that, we are also try to optimize and try to embrace our digital engagement. This is where, with all our target markets, in Middle East or even in the Asia region and all that. So we engage with all our consumers directly via our digital marketing, whether it's social media or even in the other platforms. So that is another initiative that we are currently doing. And a part of that, actually, in terms of offline activation, I would say, this is where we collaborate effectively with our partner, of course, Tourism Malaysia, and of course the other Malaysian stakeholders that currently in abroad. So that is basically in terms of commercial initiative. But of course, ultimately, we are also last year we also have already established on our healthcare travelers SOPs. Basically to allow healthcare tourists to come to Malaysia during this borders closing period. So that's one of, a few of initiatives that we are currently doing to build the confidence or to restore the confidence and the trust again among our healthcare travelers around the world. Yeah.
Okay, it's very interesting. I'm sure I'm very happy to hear all the steps that you are taking. Very interesting there. So Ms. Norhaslina, I'm going to bring you in here just to understand that what are the latest updates in terms of safety of the destination. Can you tell us a little about, the vaccination drive in Malaysia and what is the status of it? And then some about the SOPs for healthcare travelers. Can you highlight some of that for us, please?
Sure. Thank you, Devika. Okay, in terms of vaccination status in Malaysia, we are inshallah reaching 90% of the population soon. Hopefully by today is Wednesday, by end of this week, which is a much awaited news to Malaysian, as we will then be allowed to cross state. So you see, quite many of us now is in what we call movement control order, that we are not able to go back to to see our parents and whatnot who live in a different state. So, but then we understand the reason and the need for the control movement. Thus, when the vaccination status reaches up to about 90%, there's this safely reopening of the state, interstate traveling will hopefully then be allowed. That is number one. Number two, that even in early April last year, so when we first hit with COVID and then Malaysia imposed on a border lockdown or closure of borders at that time, us at MHD was thinking that, or was planning that we forecast this is not going to be a short incident. It will be a long, we do not know at that time how long it would be, but we thought that we have to be prepared because of the closure of border. So our industry, especially this medical travel, healthcare travel, suffered together with the tourism quite badly because nobody is allowed to come in, no foreigners allowed to come in. So from there, we have drafted the standard operating procedure to allow patients or healthcare travelers to enter Malaysia, and the government has recognized that, where they announced healthcare travelers for healthcare travel is the first sector that allowed to be open, meaning even though we are still in closing of border, healthcare travelers can come in. So for that, we have built a medical travel bubble itself, or the SOP, where it really dictates, or it really prescribes what patients or healthcare travelers needs to do before they even enter. Now, just to add a little bit on that. So during the healthcare travel, during this border closure, all entries to Malaysia must be or must obtain a prior approval. So so it's not like before, So before, people from the UAE, you can come to Malaysia, you don't have to apply beforehand, it's visa on arrival and whatnot. So now even our neighboring countries in ASEAN, they have to apply before they can enter Malaysia, and it also depends on the reason. So under this SOP for healthcare traveler, patients, especially our former patient or our existing patients, can come to Malaysia to continue their treatment. This is for us very important to ensure that their continuity of care is well taken care of. There were a few examples that were given or cases highlighted to us before we had the SOP. Patients have done their surgical or their operation before for cancer, but they were not able to come in to get a further treatment for chemotherapy or radiotherapy. So with this, when we crafted the very tight SOP, the standard operating procedure, they were able to come in and continue with their treatment. So that SOP prescribe what they need to do before they enter, meaning they have to submit the application, and then they have to for us to process, and then for our immigration department to approve until before, if all approval received, before they depart from their country, they have to do their PCR tests 3 days prior to arrival. And then during the arrival, they will be taken straight away to hospital, where our team actually facilitate the whole journey at the airport. Then in the hospital, they have to do another COVID test, PCR COVID test. And at the end of the quarantine period, they'll be quarantined in the hospital. And at the end of that quarantine period, they'll do another COVID test. So this is to ensure that it's not only to ensure the safety of our healthcare travelers, as well as to our frontliners, our doctors, our nurses. So I think we're up until from 1st July until now, we are seeing this has been in a way, if I can say, successful in a way to bring our patients in, as well as to maintain the bubble across the whole journey.
Perfect. So after hearing what you have said, I have a few quick walk spot kind of questions that I want to know about. Yeah. Those are more like frequently asked questions that I'm sure a lot of our travelers would want to know. So I'm just going to ask you quickly, and you could quickly tell me what you think, your opinion on that. So can you name a few treatments that people seek in Malaysia? What kind of treatments do they come to Malaysia for?
So especially during this pandemic, during this medical travel bubble implementation, we're seeing that top 3 treatments are oncology. That one is for cancer. So it's either surgical, chemotherapy, or radiotherapy, as well as the number 2 is on a cardiology, on cardiothoracic surgery, on heart, right? It's a heart surgery for adults as well as heart surgery for children. So we received a number where they had to stay even more than a month for them to undergo the operation until they recover before they are safe or they're fit to fly back to their home countries. And as we move along from last year to this year, we are seeing an increased number of fertility patients who come to Malaysia for their fertility treatment. So this group of patients, they have done their first part of the treatment before COVID period. Then now it is a time for them to come and continue the treatment, especially for the implantation of embryo and things like that. So I would say in a nutshell, again, the 3 top treatments sought oncology, cardiology, and cardiothoracic surgery for both adult and children, as well as fertility.
Okay, that's interesting. So can I get any kind of treatment in a hospital in Malaysia? Or if focus is just on the ones that you've spoken about? Okay,
for those hospitals who want to accept patients during this COVID period, under the SOP, first they must be, or patient must go to hospitals that are registered and members of MHTC only. Even then, because our SOP is rigid and very strict, not all of our members even are able to comply or ready to comply to receive patients. So at the moment, out of 73 members that we have, only 31 hospitals or facilities that are able to see or to receive patients during this under the SOP. So these facilities are everywhere in Malaysia, in Klang Valley, in Johor, Malacca, and Penang, as well as in the east of Malaysia.
Okay. And when it comes to choosing an elective surgery, and if somebody like who's not got treated before COVID in Malaysia, is that still an option?
Yes. Initially, when we first started, we've concentrated, or the priority was given to medical or serious medical cases, things like, again, oncology, cardiothoracic, and things like that. But as we, more than a year, we are receiving patients who come for fertility, for eye treatment, for knee replacement surgery, and others.
And this is a fresh set of patients, not ones who you've treated before?
Yes.
Okay, wonderful. And if a patient is fully vaccinated, how much do they require quarantine, and for how long?
At the moment, all entry to Malaysia, either Malaysian or non-Malaysian, are subject to a 14 days quarantine. For vaccinated travelers as well, still they are subject to 14 days of quarantine. They can be quarantined either for our patients, either in hospital or at hotel or designated hotel.
Okay.
Yeah, and during that, after that 14 days period, they are able to go about. Is that we caution them to observe all the precaution of being masked up, yeah, hence hygiene and things like that.
Yeah. So what if during a treatment in Malaysia, a patient gets infected with COVID? So what are the precautions that you plan to take for that? And like, how do you treat somebody who's COVID positive?
Okay. In Malaysia, for patients who are coming in under our SOP, so if they are treated or they are contracted COVID during their stay in Malaysia, they will be sent to the hospital that are accepting them in the first place. So, for example, if they are a patient of hospital A, after the treatment at hospital A, they are still in Malaysia and contracted COVID, positive with COVID-19, so they'll be sent back to hospital A. But in case there is no bed availability or whatnot, the arrangement can be made inter-hospitals, but they will be treated at private hospitals still. We are also looking at introducing what we call as an inbound travel insurance that covers a partial part of a COVID treatment, which we think that for our healthcare travelers, our patients, this would be, in case they are contracted COVID in Malaysia, this could be some relief for them in terms of handling their medical bills for COVID treatment.
Okay. And what happens if the treatment lasts longer than expected? So how would you handle somebody who needs to, if they've come for 2 months and they need to stay for 4 months?
Yeah. So usually when the patient come, they are given a 30 days visa, 30 days visa, or we call 30 days a social visit pass for the country that do not require a visa to come in. So in case they need to, or their treatment will be longer, so what we'll do is that we as MHTC will facilitate the extension of visa or stay by working with the hospital. So we'll get a doctor's letter, we'll write a support letter, and we will send it to immigration to say that the patient needs a longer treatment. Usually we are seeing that more than half of our patients who came in through the SOP have to extend their stay to more than 30 days, some even up to 6 months because of their chemotherapy and radiotherapy regime. So it should not be a problem. We will facilitate as long as we know that, there's a doctor's letter and patient must undergo that treatment regime.
Okay, wonderful. So Shahril, I'm now going to come to you with 1 or 2 questions. Can you tell me a little bit more about the Middle East market? How important is this market for you?
Thanks, Devika. Well, Middle East is very, very demanding market, I would say. You see, because for us, Malaysia Healthcare, we have been established, or we have been recognized as, Destination of the Year last year, 2020, by International Medical Travel Journal. And then Malaysia is also ranked #1 as best healthcare in the world in the Global Index International Living. So we want to maintain that positioning, or we want to maintain that credibility and all that. So that's where we need to grow our target markets, a part of course, the Asia region, right? So we need to grow the market share to further explore on new potential markets. So this is where Middle East come in place. So we see the potential of Middle East markets. Of course, given that looking at the numbers of tourist arrival to Malaysia from Middle East markets under the tourist segment, it's quite it's a very it's a very high number in terms of the arrival to Malaysia. So that's where we see the potential for us to convert them to be perhaps to be healthcare travelers. Malaysia has been recognized or has been established as a tourist destination, all around the world, even within the within the Middle East market. But for healthcare travel destination, we are still trying to get our feet on the ground and all that, especially within the region, within the Middle East region. So that's where we see the huge potential of Middle East to be our next focus in terms of where we want to go moving forward. And then I think a part of that, we are also trying to capitalize on new potential products, services, or I can say, we have a lot of niche tourism packages that we are currently focusing on. For example, wellness, aesthetics and beauty, those not too serious products or not too serious treatments. So that's where we try to tackle the market more. And then, of course, we are also trying to, because we know for a fact that Middle East is, a few of them are also position themselves as healthcare destination, so we don't want to be, a direct competitor. So we just trying to complement whatever that they are currently doing. Perhaps, certain treatments or certain cases that they won't be able to perform or they won't be able to service. That's where we try to establish the bilateral arrangement or G2G agreement and all that, between one country to another, of course, in this case with Malaysia, to provide perhaps, second opinion or patient referral and all that. So to ensure, of course, the continuity of care of the patient as well as the safety of the patient. Yeah.
So I'm just going to stop you here. I'm going to ask you one last question before we close for today. What would you say is your new go-to market strategy for tourists from the Middle East once borders open? So have you pinpointed at anything yet?
During this, from our side, we are calling this period is rebuilding phase. So we are focusing on two major areas or two main areas, I would say. One, of course, the capacity building that I mentioned earlier. So this is where we collaborate effectively with all players, and it also includes players beyond healthcare services to ensure patient journey. They will receive all the best experience when they come to Malaysia for healthcare treatment. And then, of course, digital marketing is it's a big thing now currently as we speak. So this is where we can interact or engage directly with the consumer. So that's where we try to localize the content, make it relevant to the market. And of course, I mentioned earlier about patient experience. So that's another main area that we are looking at. We try to provide the best experience in terms of, when they come to Malaysia for treatment, for example, perhaps they need a translator or interpreters, to accompany them, for that to ease communications and all that between them and the specialist or the doctor. So we are providing that as well. And then we also try to provide the meet and greet service. We have MHTC have a service that can welcome our healthcare travelers at the airport, at the Aero Beach, and then try to smoothen their process at the airport to ensure no hiccups, no glitch and all that along the way. So again, enhancing patient experience is our priority. And last but not least, I guess, embracing digitalization. So this is where telemedicine and teleconsultations are in place for most of our healthcare providers or hospitals here in Malaysia.
Lovely. I think that's a very, very well thought out and planned strategy. And I love the idea of rebuilding. So friends, we're going to come to the end of our discussion today, but I'm going to give both my panelists a chance for a closing note. So Ms. Norhaslina, can we start with you? Your closing remarks on why Malaysia healthcare. So from your heart, what do you feel?
Because I think there are a lot of things that you can experience other than just the tourism. Healthcare in Malaysia is something that is not really known abroad other than the region, but there are lots of potential, there are lots of things to do, and we, like Shahril mentioned, the patient experience, so we will be there to welcome you, help you through the whole stay, as well as to help you to get better. I think yes, when borders open, we'll be welcoming you with an open arm.
Yes. Lovely. Over to you, Shahril.
Again, I also echo to Ms. Norhaslina. At the end of the day, for Malaysia healthcare, we are waiting for borders to fully open. To be honest with you, we are looking forward to welcome back our healthcare travelers around the world. Given that the accessibility that we have here in Malaysia, the quality services that we have here, it's like most of our providers are top notch in terms of healthcare services. And then again, the affordability factor is also one of the big factor or consideration for our healthcare travelers to choose Malaysia as their destination. So again, we are looking forward to have all healthcare travelers around the world to experience Malaysia healthcare once the border are fully open, inshallah.
Lovely. On that very positive closing note, I would like to thank both of you for being here with us today. Thank you so much for that extremely insightful discussion. And hopefully all our audience would have also enjoyed the discussion as much as I enjoyed it today. Thank you again. Thank you so much.